Hello everybody. Welcome to number 1 Doctor channel. Today we have an anatomy revision session in form of questions and answers. Are you ready?
Yes, doctor. I am ready.
Today the questions will be about abdomen and pelvis. What type of joint is the pubic symphysis?
Secondary cartilaginous.
Where does the false pelvis end and the true pelvis begin?
At the pelvic brim.
The umbilicus lies approximately at vertebral level L3. Which dermatum supplies it?
T10.
Name 4 structures that are overlain by the attachment of the small bowel mesentery.
Right ureter, inferior vena cava, aorta, third and fourth parts of duodenum, right psoas.
What artery supplies the appendix?
Appendicular from posterior caudal branch of ileocolic artery.
You are looking for the appendix, and it is not immediately apparent. What structures in the wall of the cecum could you follow to find it?
The 3 Taenia coli lead to it.
What is the clinical condition of the pylorus that occurs in early childhood that leads to projectile vomiting? How is it treated?
Pyloric stenosis. The thickened circular muscle is split surgically.
Is the first part of the duodenum retroperitoneal, endomesentery or half and half?
Half and half.
What is the immediate posterior relationship to the majority of the second part of the duodenum?
Hilum of right kidney.
Psoas and iliacus have similar actions but different nerve supplies. What is the nerve supply of each?
Psoas, segmentally in abdomen by L1 and 2. Iliacus, femoral nerve in abdomen L2, 3.
Which muscle holds down the 12th rib on respiration?
Quadratus lumborum.
Iliohypogastric and ilioinguinal nerves are both L1. Which one is the main nerve, and which one is the collateral branch? What is the evidence for this in the sensory distribution of the buttock skin?
Iliohypogastric is the main nerve with its lateral cutaneous branch supplying an area of buttock. Its anterior cutaneous branch supplies skin of mons pubis. The ilioinguinal nerve is the collateral, muscular, branch supplying the conjoint tendon and lower transversus abdominis and internal oblique abdominis.
In the upright position, which 2 bony points on the pelvis lie on the same vertical plane? Which 2 points lie on the same horizontal plane?
Upright, anterior superior iliac spine and top of pubis. Horizontal, tip of coccyx, approximately the ischial spines, and top of pubis, pubic tubercle.
Has the male or female pelvis a wider subpubic angle?
Female.
Where on the hip bone do the 3 constituent bones all meet?
Center of acetabulum.
The triangular base of the bladder is the trigony. From what was it derived embryologically?
Mesonephric duct.
At the lower apex of the trigony are the bladder neck and urethra. What are the 2 upper apices?
The ureteric orifices.
What prevents urine flowing back up the ureter from the bladder?
The ureters enter the bladder at an oblique angle and run through a submucosal tunnel before opening into the bladder. This prevents reflux of urine.
The normal description of the uterus is A. Retroflexed and anteverted, B. Anteflexed and retroverted, C. Anteflexed and anteverted, D. Retroflexed and retroverted.
C. Anteflexed and anteverted.
Are the following statements true or false? A. The broad ligament does not enclose the fallopian tube.
False.
B. The ovary is suspended on the mesosalpinx.
False.
C. The lateral edges of the broad ligament become the suspensory ligaments of the ovary.
True.
D. During pregnancy the uterus is no longer covered in peritoneum.
False.
Apart from the uterine artery from the internal iliac, which other artery contributes to the blood supply of the uterus, and where does it originate?
The ovarian artery from the aorta at L2.
The external oblique muscle arises from the last A. 6 ribs, B. 8 ribs, C. 10 ribs.
B. 8 ribs.
As the external oblique arises it interdigitates with 2 other muscles. Which ones and on which ribs?
Last 4 ribs, latissimus dorsi. Ribs 5 to 8. Serratus anterior.
The lower free edge of the external oblique is the inguinal ligament. To which 2 bony points does it attach?
Anterior superior iliac spine and pubic tubercle.
What is the position of the deep inguinal ring in relation to the inguinal ligament?
1 cm above the midpoint of the inguinal ligament.
The deep ring is a hole in which fascia?
Transversalis fascia.
What muscle makes the immediate lateral border to the deep ring?
Transversus abdominis.
What two muscles lie immediately anterior to the deep ring?
Internal and external oblique.
What blood vessel lies just medially to the deep ring?
Inferior epigastric.
We see that there are two muscles interior to the deep ring to give it strength and protection. What two muscles lie posterior to the superficial ring for similar purposes?
Internal oblique and transversus abdominis in the form of the conjoint tendon.
Concerning the boundaries of the inguinal canal, the floor is the
floor is the inguinal ligament.
The roof is curved fibers of.
The roof is curved fibers of the internal oblique muscle and the transversus abdominis muscle.
The lateral third of the interior wall is the
lateral third of the interior wall is the internal oblique and the external oblique. More medially, the interior wall is the external oblique only.
The posterior wall is.
The posterior wall is transversalis fascia and the conjoint tendon.
Thanks for watching. With my best wishes, Dr. Usmle.